talk about the Plab exams. If you're finally you're a medical student or about to graduate in the next couple of years, then this is the pathway which is going to be more relevant to you. The objectives of this exam is essentially to know that you are competent at the same level as they would expect a foundation year 2 doctor to be at the beginning of their foundation year 2. What this essentially means is that you've done your medical school and you've done your first year of foundation 1 training, which would essentially be the house job equivalent to Pakistani students. And the other thing is, because it's also a linguistic examination, they want to make sure that your English language is competent to pretty much survive in the UK healthcare system. It is done by 2 different ways. First of all is the IELTS exam. You need to have a minimum IELTS banding score to sit the Plab exam. And the second is you also get marks for the English language and how you speak to patients during the Plab 2 exam, but more on that later. To start the entire process, you need to go to the GMC website and you need to enter all your details. They ask you for your past experiences, what medical school you went to, when do you graduate, or when did you graduate. And then once everything is done, there's a bit of a processing time between 2 to 5 days, after which you get your GMC number. And once you get your GMC number and you get your IELTS banding score, then you can apply for the Plab exams, and you apply the Plab exams through the GMC website as well. The earlier you start on this, the better it is, because a lot of the times I find that people that I know who came from Pakistan had to struggle quite a lot for the IELTS scores, getting the right scores for the IELTS. So I think the earlier you start, the better. And I think the IELTS scores are valid for up to 2 years. So in a way, if you are a final year medical student and you plan to sit your IELTS exam first and hopefully get the right banding, then at least this is one less thing to worry about. And then you can just focus on your Plab exams rather than having to worry about both studying for the Plab exam and the English language exam at the same time. As mentioned earlier, there are 2 parts to the Plab exam. Part 1 is a written exam. You've got 180 multiple choice questions and you've got 3 hours for that. It's about 1 question per minute, and it is as tough as it sounds. I mean, I've given other exams as well. This was very, very constrained for time, this exam. And the more you practice, the more questions you practice, the more you try to, again, speed up your reading and your reflexes to answering questions, the better it is. So the more you practice, the better. As a whole, I think the Plab 1 exam is as difficult as your final year medical school exam. It's just that at the same time, you also have to be very, very good and very sharp at answering questions very quickly to make sure that you finish your exam on time. And the more questions you do, hopefully the more marks you'll get as well. The important thing to know about the Part 1 exam is that unlike other exams like the USMLEs or your medical school exams, scores don't matter. No one asks you how much score you got in your Plab 1. You do get a score for the Plab 1, but no one asks for it. It's basically a pass or a fail exam. You pass it, and then you can go ahead and book for the Part 2. If you don't pass it, then you have to reattempt it again. But don't worry too much about the scores. The Part 2 is an OSCE exam, so that's the Objective Structured Clinical exam. The way it's conducted is that you've got a real life scenario, and they could be anything. They could be ethical scenarios, they could be medical, surgical, obs, gynae, pediatric scenarios, sometimes history taking, sometimes a bit of examination, and sometimes acute medical take scenarios as well, where they bring a simulated mannequin, and the simulated mannequin can talk, can have clinical findings like auscultating the heart, listening to the breath sounds of the patient. And then you would be expected to do a full physical examination on that patient, actually tell them and identify the findings that the simulated mannequin is showing, and then make a clinical judgment and a clinical management plan out of it. It's an 8-minute per station exam. So it's quite a long day, the day you have to give your Plab 2 exam. But if you prepare well for it, and if you're in good habits from day one when you enter clinical years of your medical school, and you're used to seeing patients, you're used to structuring your history-taking examinations and then presenting your cases to your clinical supervisors, the more you'll be in good habits, and the better it will be for you in the long run when you finally have to sit your Plab 2 exam. Now, the part one exam, how to prepare for it essentially. Like I said, so it's the standard for the Plab one exam is the same as your final year medical school exam. There's a bit of medicine, surgery, obs, gynae, pediatrics, psychiatry. And there are multiple resources that you can use for the Plab 1 exam. I think the problem with a lot of my colleagues who came from Pakistan to give the exam was basically the lack of knowledge and not knowing where to study from. I know there are multiple Facebook groups and people have, I think, Google documents as well that they keep sharing around with different questions. I think I'm not sure what the source of them are, but it was very, very popular when I was asking people about how to study for the Plab 1 exam when I did it myself. Um, Now, those resources, I don't want to say they're bad resources, but I think it's not a true reflection of the exam. And I think that's very important to appreciate from the very beginning before you start studying for these exams, because you don't know where these are coming from. And also, the exam keeps changing. The trend of the exam keeps changing. It's not going to be the same exam that, say, people who formulated this kind of document that's being circulated around, or what people post on Facebook or share on Facebook. So the trend of the exam keeps changing as well. The two popular resources that I know most people use is Past Medicine, and there's another resource called Plabable. Now, I can't vouch too much for the Plabable. I think it's slightly more expensive than Past Medicine, and it's a resource that is only giving you question banks for the Plab exam. Past Medicine is probably one of the most popular question banks in the UK. People use it for, from final year medical school to the Plab exams. And then they also have very, very popular, it's probably the most popular question bank that people use for the MRCP exams and the other specialty exams as well. So it's both the UK and international medical graduates both use the Past Medicine question bank. So I highly recommend, if you want to get a question bank access to study for the Plab exam, go for the Past Medicine. It's also very cheap as well. It's probably the cheapest question bank you have. I think you get a 3 months access for £12, which is not bad compared to what Plabable or other question banks charge you. And about 1 to 3 months of study time should be sufficient for the Plab 1 exam, especially the sooner you give it right after your medical school exams, the better it will be, because your knowledge will be more fresh. And then if you start from, say, Past Medicine, study for about 3 months and give the Plab 1 exam, hopefully everything should be all right. The part 2 is a clinical exam. So like I mentioned, it's an OSCE exam, and the sooner you get into good habits to prepare for the exam, the better it will be. What I suggest we do for the Plab 2 exam is do good group training when you're studying in medical school. Also, do assessments for your colleagues when you're studying for medical school exams. The way these assessments can work is making sure that your history is very well structured in a very timely manner as well. Your examinations are very well structured in a timely manner as well. And I know most of the people, once they pass their Plab 1 exam, they go for different courses that are available within the UK. Now, I think it would be very difficult for me to recommend any one particular course in the UK. I've heard very good things about different courses. So I think talk to your seniors who have recently given the exams, find out what their experience was. And I know, again, depends on who you ask and what other people, your colleagues, and what their experiences are. People usually recommend, for some reason, that after you give your Plab 2, once you take your Plab 2 course, people take a month or 2 months to practice before they give their Plab 2 exam. I'm not a huge supporter of that. I think I gave my exam maybe a week later after I finished my Plab 2 course, and I thought that was very sufficient. It's a crash course and a very lengthy course for up to 2 weeks. And I think the more you can cram in 2 weeks, and if you, from the very beginning, you've got yourself into good assessments and clinical habits, the better chances you have of passing the exam. Now, this is very important because there are some changes coming to the Plab examinations, and this will be applicable especially for third or fourth year medical students or people who are still very early on in their medical schools. Is that the Plab exam is actually being replaced by the UK MLA exam in early 2023. It's an exam which is going to follow the same trend as the USMLE. So both international medical graduates and the UK graduates will be expected to give the exam. I'm not sure whether it's going to be a pass-fail exam like the Plab, or whether it's going to be a score-dependent exam like the USMLE, but I think more on that will come later. I would recommend whenever you're looking for information regarding the exam, always consult the GMC official website. Don't go to Facebook pages or ask your friends, because the more authentic the source of information, the better and more chances are that the information is accurate. Now, this exam will essentially have two parts as well, just like the Plab exams. So you'll have the equivalent of the part one Plab, which will be the applied knowledge test, and the second one will be the clinical and professional skills assessment. So this is more relevant to people who will be giving their exams, or they think they'll be giving their exam in early 23. So for the next 2 years, if you're planning to come to the UK and give your licensing exams, then the Plab route is for you. If not, if you think you're going to be coming to the UK in about 3 years' time, then the UK MLA is for you. And the more you read about it from the GMC website, the better it is. There are currently absolutely no question banks out there that will tell you or give you an idea what the exam would be like. But again, make sure that you're updated from the GMC website, and I'm sure more resources will come up. That's it for me. Thank you.
Thank you, Dr. Mubin. Thank you so much. If you have any questions for Dr. Mubin, kindly post them in the Q&A section. Once we are done with the presentations, we'll proceed to the question and answer session, where we'll try to answer as many of your questions as we can. Our next panelist graduated from the Allama Iqbal Medical College in 2015. He has been working in the UK since 2017. He is now a core surgical trainee and surgical representative for the Trust, South East England Deanery. I would request Dr. Zuhaib Shahid to please share his experiences with our audience and guide them on how to prepare for the Plab exams and how to develop their portfolios. Over to you, Dr. Zuhaib.
Sorry, is it? Hi, sorry. So thank you very much, Dr. Hassan, for having me and for giving me the opportunity to speak. And thank you, Mubin, for an excellent presentation. So I'm Zuhaib, and a core surgical trainee working at a big DGH in Kent. What I must say before I start is that for everyone who's joining this presentation today, you are already miles ahead of your colleagues and your compatriots who will not have the awareness of how to develop a portfolio from an early stage. So so well done for joining in. Okay. Sorry, I'm just having an issue with my slide. Sorry. Yeah. So once you pass your Plab exam, essentially you will be joining at this FY2 stage, and you will be a trust grade or a staff grade joining at an FY2 stage. In the UK, the house job is for 2 years. So most of you would have done your FY1 year, and you will be joining an FY2 year. And during this 1 year, or I would say about 10 months, practically speaking, you will be building up a portfolio of evidence of things that you have done in the last 2 years so that you could apply for this training job. Your aim will be to get into this training pathway, which is recognized by the Deanery for training. And most people, like myself included, did not have much evidence, and so hence that makes it very difficult for you guys to compete and get into the training post. So if you start right now, that's already an excellent start. So the challenges that you will face once you complete your exams will be to adjust to a new country. Many of you might have personal challenges and also financial challenges and academic challenges, as we discussed. So having done something productive during your undergraduation and your house job in Pakistan will immensely help you, and all of these challenges, or the scale of it to some extent, will be diminished. These are just a few slides to show the competition these days. As Professor Shahid said, if you are smart and if you are proactive, then actually these days it's fairly, if you're obviously competent enough, it is very realistic to get into a specialty of your choice. So you can see over here that anesthetics, approximately 2.5 people for 1 seat. For medicine, it's 1.5. Cardiothoracics has always been extremely competitive. Core surgical training is right up there with 3:1. But as I said, if you are proactive, then it's definitely a very achievable target. A few more slides. You can see gynae obs, 2 candidates for 1 seat. Pediatrics is, these days there's a big shortage, and as Professor Shahid said, that this will be the case for the next few years. Coming on to the portfolio now, I certainly did not have any clue of what a portfolio is and what I have to do. So a portfolio essentially is a checklist of things that you have to build up during your house job years, which will be the 1 year of house job in Pakistan and then the 1 year of trust grade job. And you have to basically collate that evidence. I'm just showing you just for as an example, a surgical checklist, but it's basically the same for any specialty. So you can see here that there are set points for doing things. Now, most of us will not have an additional degree unless you have done a previous bachelor's and then join MBBS, but most of us are not in that position. So we can, I wouldn't really worry about that much. I mean, you can do your BSc, BA English, which does count for a few points. And yeah, so you can see there's a section for courses here. Once again, at your stage, I wouldn't really worry about the courses that much because you will have at least 1 year in the UK to do the courses. Then additional achievements. So if you've got none, you get no points. If you have got some, you get 2, 3, 4, and 5. And I will discuss this in a bit more detail, but these are very achievable things, but you just have to be, you just have to have the awareness that these checklists exist. Quality improvement and audit. I did not know what an audit was. I don't know if that was a problem with the education in my medical school or if that's a cultural thing. But once again, I had to do my first audit when I came to the UK. There's no reason why you cannot do an audit and get all 11 points. Over here. Presentations. Once again, most of us are so into academics that we sort of ignore these kind of things. And I will speak to you about this in the coming slides. But once again, you can max out on the presentations if you are willing and enthusiastic to present. Same goes for publication and teaching, but I will get to this in a bit. And so you can see it's about a 4-page checklist, which is very doable, but you just need to know. This is another screenshot of an internal medicine checklist. Once again, with very similar things that they test you on. So presentation, publication, teaching, leadership prizes, awards. So it's pretty much the same. So I think a good thing is to break it down into different sections. So teaching is a very heavily tested aspect of your portfolios. It is it's the easiest and the cheapest, and by cheapest I mean that you do not need to spend any money on it. All you have to do is teach a group of students or healthcare professionals like your physio. I mean, correct me if I'm wrong, but I think the UCMD does have other allied professionals as well, such as a physiotherapist and so on and so forth. You can teach them for a period of time, get your consultant to give you a certificate that you have done the teaching, and get feedback, and you could max out on the points. It's very easy to do, but no one really does it. This is just an example on how I got feedback. So I organized teaching sessions at a particular trust, got feedback, and that's it. You've got your points. Audit and quality improvement. Basically an audit is a way to see what your local practices are against the set guidelines. You would be surprised that everything has got nice guidelines, everything has got gold standard guidelines for things, such as how to scrub, how long do you put a cannula in a patient for, and that sort of thing. And you can see in your local departments, if you are following the guidelines, try to make changes and develop or improve on the previous SOPs. I'm absolutely sure that your professors and your head of departments, if you are enthusiastic and if you want to do these things, will always encourage you to do these kind of things. And then once you've done it, present it, because then there are points for presentation. So you kill two birds with one stone. Which brings me on to the next slide, presentations. Now, I can tell you that it's very hard to give a presentation in a foreign country if you haven't done it in your home soil ever before. So get in a habit of a presentation. And I think Professor Shahid will also tell you that the guys who are active in presenting in Pakistan are the same guys who have been presenting for 2 decades. So if you have to be at the top of your game, you just have to appear at all these conferences, and so on and so forth. I think the UCMD has been organizing many internationally recognized conferences, and if you want to present your work, then I'm sure they will facilitate you, and you would max out on points for getting an international presentation, which many, even the local graduates, struggle to do that. So guys, just make just use the resources that you have. Also, within your departments, there will only be a handful or maybe 1 or 2 people who would actually have an aptitude for presenting. So speak to them and try to present an interesting case and audit. Anything can be presented, and then obviously get evidence of your presentations. Publications is, I think, a very hard aspect of the portfolio, partly because it takes time, and secondly, the culture in Pakistan isn't really to do a lot of research. But I had a presentation done in Pakistan. If you are struggling, I don't know if Hussain can help you, or if the education department can help you, but certainly your community medicine department can help you do some research or project. And so speak to them, say that you want to do research. I'm sure they will help you. This last point is very important. So developing an aptitude for research right now will help you a lot. You don't want to work in a foreign country and then after 2-3 years you have to start from square one. So see how to write papers and that sort of thing. It's a skill that you will be heavily tested on later on. Prizes, once again, the portfolio has got clear points for this. If you don't have any prizes, you don't get any marks, but you can be very proactive, and you can be very I'd say you can be very proactive about this and get prizes. So any undergraduate scholarships and distinctions count as prizes. You could put any arts prizes and sports prizes during your undergraduation. And if the university is organizing an event, and if you see that there's a potential for a prize, speak to the organizers. I'm absolutely sure that for the betterment of your future and for your portfolio, they will facilitate prizes, which will help you quite a lot. Being a class rep, a society rep, team captain, and being active on the debates will help you tremendously. And it will also boost your confidence, because you cannot shy away from presenting your work for much long, because once you are working in an international hospital, you will be expected to work. Once again, the university does plenty of a presentation, so if you have put in a lot of effort, I'm sure your professors and your HODs will be happy to write something good about you, which can count as a prize as well. So exams. Now, obviously, Dr. Mubin just spoke about the Plab exam. Many of you will be entering the UK as soon as you do your house job. It is worth considering that if you can, even though these exams only constitute 1 point of the portfolio, it will save you from a lot of headache if you can either do this exam before getting your first job, which might not be feasible for many because you will be obviously you would be unemployed, and you'll have to sit for a few months and do these exams. Or it might be worth coming back to Pakistan and do this exam. But even if it's not an economically viable option for you, if you have put in the effort as an undergraduate in developing your portfolio, that's a big burden off your chest. And then you can just adjust to your new jobs in the UK, and then you will have more time for this, rather than not having a portfolio, having to do everything from scratch, adjusting to the new hospitals, and then also having to worry about this exam. So these are the exams. So it's the MRCP Part 1 for medicine. For surgery, it's the MRCS Part A. And for the radiology training, it's FRCR. But basically, it's a Part 1 of the Royal College for whatever specialty that you want to do. So really, the take-home messages that I would say is that, firstly, well done for tuning in. Having an awareness right now I'm sure you will thank me, and if not, then you should, because I wish I had been taught about these things. I'm not exaggerating when I say that you could potentially save up to 1 year of your time if you have been an enthusiastic undergraduate. You have to realize that you will be competing against the local graduates who I have seen that even from second year and third year are presenting at conferences, and they know their professors. So many of them, I'm not saying everyone, but many of them are very driven people. So there's no reason why you cannot do the same. And just from an outside view, I certainly think that the university does have the infrastructure and the facilities for you to develop a portfolio. Be proactive. I don't see any reason why your professors or your tutors or your head of departments, your assistant professors would not help you if you are enthusiastic about your work and your house job. And if you want to do something, I'm sure they will facilitate you. And certainly, if you feel that that's not the case, then escalate it to the education department, escalate it to the pro-rector, the principal. Definitely. Collect all your evidence. That is really important. You might have done 20 appendectomies during your house job, but if you do not have evidence for that, you haven't done it. So just create a logbook for any complex procedure, pleural tap, acidic tap. Just keep it. It will really help you. And yeah, find the right people. As I said, there will only be 1 or 2 like PGs in the department who will be proactive and who will be very driven people, and stick to them, and they will help you. I would like to end this by saying there's a saying that I found which I really like, and this has got no correlation with the portfolio, but a kind gesture can reach a wound that only compassion can heal. Just be kind in what you're doing. I have seen people ignoring patients, and I've seen very inhumane things. So don't be that kind of doctor. Certainly if you do that over here, you'll be in big trouble. So be kind. Speak to the patients. People have a lot of faith in you, so that is very important. I think that's like the most important thing for a doctor anyway. I will leave my contact with Dr. Hussain, so if you've got more questions, then you can email him and I'll try to answer them back. And I think that's it. Thanks very much.
Thank you, Dr. Zuhair. Thank you so much. You have rightly said, use the opportunities that you have. Our undergraduate medical students have a lot of opportunities, like being part of a international conference. Fourth year MBBS has their research clerkship coming up in a month's time, so they better utilize that time. And we do have reflective portfolios as part of our undergraduate program, and we encourage them time and again to get into a habit of keeping their portfolios updated, putting in the entries, getting them signed, because that's the evidence of their learning.
Absolutely. And I think I think that's quite amazing that you guys are doing that, because they will find it a lot easier, and the university does have the infrastructure for you guys to facilitate them, definitely, and it's up to them now to use these. Yeah.
Thank you so much, sir. Now we shall proceed to our question and answer section. We have a hefty amount of questions lined up, so if
Yeah.
you both the panelists could join us. Thank you, Dr. Mubin and Dr. Zuhair. The first question that we have is by Dr. Rabia Sarfaraz, and she's asking what is the passing criteria, I assume, for the Plab exam?
I think the passing criteria, so the Plab 1 has a different passing score every single sitting. It depends on how well people are doing for that exam. But I think overall, yeah, if you're doing well, then chances are that you will pass. It's very hard to say what the passing criteria is, but it's sort of more like standard deviation. It comes up to be about 60% or close to that to pass the exam.
So, okay. The next question is a bachelor's degree in English compulsory to apply for Plab?
No, it's not. It's just an easy way to get a point on the portfolio, but it's not.
There's
you need
another
to do
question.
the IELTS, no?
There's another question. What's the difficulty level of the questions? Is it as much as FCPS Part 1 questions?
No, I think, like I mentioned, it's as difficult as your final year medical school exam, not more harder than that, both the Plab 1 and the Plab 2, because they expect you to be at the level of a foundation year 2 doctor, which is basically a person who's completed medical school and done their house job.
Okay. So the question is, do you get a choice of your choice of training in UK? Because the person has heard that you only get into psychiatry mostly. They don't give out residency in surgery. Is that true?
I think that's not well. It used to be true to some extent, but now there are no restrictions on where you apply and which specialty you have to apply in. So if you're competent, and if you are good, now you can apply to any specialty. So no, that's not true. There are Pakistanis who are in surgery and cardiology, gastro. So no.
Good to hear that. Good to hear that. Okay. The other question is, if someone has done O levels, do they still have to appear in an IELTS exam?
Yes.
Yes. So simple answer. Yes.
Yes.
The other question that we have is, what's the syllabus for this exam and which books do you recommend? Dr. Mubin had already mentioned a lot of books. Can you again reiterate those resources?
Like I mentioned, I think I would personally recommend the Past Medicine. If you go to pastmedicine.com, that's a question bank, and get access to the Plab 1 exam. And that's what I recommend. The difficulty level, again, like I mentioned, it's the same as your final year school exams. But this is the resource, the Past Medicine, that I would recommend.
And the syllabus would be the same as an undergraduate course?
Yeah, it would be the same. A bit of medicine, surgery, obs-gynae, pediatric, psychiatry, the core specialties.
Okay, thank you, sir. The other question that we have is regarding the financial outcomes after doing Plab. So they are saying that you don't earn much once you do Plab. Is that true?
Sorry, let me read this. It's just try to keep your questions to the point, please. Survive. If you earn 4 lakhs on your residence is about 3 lakhs. That's too many numbers, but what I can say is that that's not true. I think would you agree that it's comfortable when you do your Plab? Yes, obviously when you are doing your Plab, there is a period of time when you're not earning. So
I think right after finishing your Plab 1, I think what they would be relating to is the kind of job that you get right after doing your Plab 1. Like, say, how much do you earn as a foundation year 2 doctor? I think as a foundation year 2 doctor, you earn decent money. I think compared to countries like Pakistan, you earn quite a lot. But if you compare how much, say, junior doctors are making anywhere else in the world, I think the UK is very comparable to the United States or Australia in terms of how much junior doctors or how much you earn during your training. So I don't think there's any discrepancy. I'm talking about just the trainee salary or foundation year 2 onward salaries until you become a consultant. There's absolutely no discrepancy. So I don't think there's any other country that's paying more than the UK. There are probably a lot of countries that are paying less, but depends on what kind of a person you are. I think it's a comfortable salary.
Yeah.
Thank you, sir. Can you elaborate on how UKMLE is different from Plab?
We haven't done the UCMD.
So it's like I mentioned, it's the UKMLA exam. It's the medical licensing assessment exam. It's going to be 2 parts, just like the Plab 1 and the Plab 2, just with different names. But on how is it going to be different? There's going to be more information on the GMC website. I just wanted to mention it so that people who are going to be doing it in 3 years' time are more aware of it. But if you're doing it in the next 2 years, don't worry about it. If you're doing it after 2 years, then go to the GMC website and there's a roadmap that you can look at to see how it's going to be different from the Plab exams.
Okay, thank you, sir. So now they are asking us to compare USMLE from Plab and MRCP. So another exam comparison.
I've given the USMLE exam. I think the USMLE exam is a different kind of exam. The Plab 1 exam is equivalent to your medical school exams. The USMLE is equivalent to the MRCP exam. So I don't think you can quite compare these 2 exams. But I think to keep it more relevant, we'll just talk about the Plab exams.
Okay. So the other question is, resources you suggest a final year student for core knowledge. You have already answered this. Past Medicine website.
I really vouch for Past Medicine. Get an access to Past Medicine. There's also a Past Medicine for final year medical students. I personally had it myself when I was a final year medical student. So I used to do questions from there, and it helped me quite a lot when I passed medical school and went on to give my Plab exams. So I do recommend the Past Medicine question bank.
The next question is that they have heard that people say it's better to do FCPS and rather than do foreign licensure exams. How do you compare that?
I mean, it's a difficult question. It really depends on what you want to do. If you want to go abroad and train, my generic advice would be to start as early as possible to enter at the bottom. I don't know if you agree or not, but I think it's best if you enter the FY2 stage and then the CT stage. Doing your FCPS and then, I mean, there are a few elective exchange programs, but I think the proven best way, and I could be wrong on this, is to go at the earliest stage and then apply for a training post. I know there are a few student exchange programs, but I don't think they necessarily guarantee you a training job.
Yeah, no,
I think they're trust grade jobs for.
No, I think I definitely second that. There are a couple of things I think to be aware of. If you enter at a higher level in the UK, if you're entering at a registrar level, there will be a lot of challenges that you have to face, much more than if you enter as a foundation year 2 doctor. One of them would be, like, say, doing clinics and having the competencies to do procedures. On a acute medical take or a surgical take, you might have to do procedures that you might not really be comfortable with, but those will be part of your competencies. If you haven't gone through the very beginning, then it might be difficult for you. Again, the same thing goes for doing clinics as well. So I don't know whether that's a very good option. Also, if you plan to enter a very competitive specialty like surgery, or you want to go into cardiology or gastroenterology, chances are that you might not get the specialty of your choice if you enter at a higher level. No one is going to give you an ST3 job if you haven't done training in the UK.
Or at least some training in the UK. So and we do have people who come at a slightly senior stage after being an MO in Pakistan for 3-4 years, and you can see that they are struggling with the junior jobs, not because they are bad doctors, but just because they haven't been in the system. So me and Dr. Mubin wouldn't really recommend this personally, but it's up to you.
Oh, okay. So if you intend to train abroad, then it's better to start early, get into a junior level job, and then work from there. That's a good.
I think so.
So, what is the best time for attempting Plab 1 and Plab 2 exams?
I think
you've already answered that.
As soon as you graduate, go for the Plab 1, and as soon as you do the Plab 1, go for the Plab 2. because your knowledge is more fresh. Otherwise, you'll have to revise the entire thing again.
There is another question down the list, and they want to know how much difference should be there between Plab 1 exam and Plab 2 exam. Should you appear in Plab 2 immediately after clearing your Plab 1, or wait for some time?
I personally
Already
did it myself, and that's what I personally recommend as well. I mean, there's no point wasting time between the Plab 1 and the Plab 2 exam, and also because the knowledge is more fresh as well. You still do need some basic clinical knowledge to go for the Plab 2 exam as well. So the sooner.
Okay. Someone is asking, like, Plab 2 prep courses can be done in any other country other than UK?
I've heard there are other courses in Pakistan. I think there are a couple in the Middle East as well. I personally haven't heard too much about them, so I can't say, but there definitely are courses.
But the Plab 2 exam only happens in UK, right?
Yes, yeah.
So again, the same question, can we give Plab 2 exam after 1 year of giving Plab 1, or is there any time limit? For example, is it necessary to give Plab 2 within uh, a certain time period after your Plab 1 exam? Is there a limit?
The Plab 1 expires in 2 years.
2 years, so they have to appear within that time frame.
Unless you've got some really good excuse, I don't think you should be waiting 2 years to give your Plab 2 anyways.
Yeah. Sir, this is for you, Dr. Mubin. Is it compulsory to complete your house job? Like, if you have passed your Plab exams and your house job is not complete, can you still start your training in UK?
So there are a couple of problems. There are a couple of problems in applying for registration with the GMC when you're done with your Plab exams. When you do your Plab 1 and the Plab 2, and like I mentioned in my presentation, they expect you to be at the same level as a foundation year 2 doctor. That means that when you get your registration after passing the Plab exams, they want to give you the full license to practice. And that's different from just being on the GMC register. If you don't have your Plab, if you don't have your house job in Pakistan, that means you can't tell them that you've done a house job, because they do ask a minimum of 12 months of clinical experience. There are alternate pathways. If you haven't done your house job, there are alternate pathways where you do the Plab exams and then apply for a standalone Foundation 1 program. But that's very, very competitive, because there are only a handful of seats, and they usually go to European graduates, because European graduates enter through a different stream to get the GMC registration. So if you're coming from Pakistan and you haven't done your house job, it is still possible. It's not impossible to get it, but it's going to be very, very competitive.
Okay. So there was another question, like, do we have to do 1 year of house job? So you have answered that as well. So there is a question, what about the Ireland situation? They don't have an exam, but they have a certain criteria. Can you tell us something about that?
Wait, what was that?
The Ireland criteria. Well, I personally don't know, but I think it's quite similar. But yeah, I don't have any idea on the Irish. On the Irish.
How important is the research component in Plab? How much it matters in the selection process? Dr. Zuhaib was talking about it, so can you take it?
I don't think it's a prerequisite to the Plab exam. What's the question? Sorry, are we?
How important is research component in Plab? How much it matters in the selection process?
Okay, so the research is not needed for a Plab exam. Okay, the research is only an evidence when you are applying for a training job, and it only then becomes very important. So so when you are applying for training posts, then it becomes more important, and it can give you a very valuable points. And if, as you mentioned, that the university or like other people in their medical schools have got the facility to do a research project, I highly recommend doing it. It's not compulsory, but it's very desirable, and certainly at some stage in the UK you will be asked to produce evidence of research work.
Okay. Someone has asked, like, if you have done your license exams in UK, will you be able to work in other countries? Every country has their own licensing exams.
Yeah, once again, we will not be able to answer this question, but I mean, and once you have completed all of your exams, there is generally some, I think for UK trainees, they can probably go to Australia, maybe a few countries in the Middle East, but once again, it really depends. But I think the Middle East is mainly the big sort of market for UK trainees.
But that's after you do your Plab
Yeah,
exams and then
and
get a
do the
UK.
training
Yeah.
and do your complete your training.
Yeah.
You cannot just do Plab and go to another country.
So, Dr. Zuhaib, this one is for you. What do you mean by an audit?
Yeah, an audit is basically, as mentioned in the presentation, it's a tool to see how your current practices are comparing against the guidelines. So, as I said before, everything or every medical practice that we do is based on some guidelines. Just as an example, a cannula like an IV line can only be inserted in a patient up to 3 days. So you could easily audit this in your department, seeing how long these IV lines are being put in patients for. I won't be surprised if they are not complying with the 3-day target. And then you educate the nurses, you make SOPs, and then you re-audit this. And once they comply with your guidelines, then you can say that you identified a problem, you made a change, and that change is now working in the department. And there are guidelines for everything. Even you would be surprised for catheters, for how to wash your hands, what prep you use. So there are guidelines for everything, and your seniors and your professors will be able to help you with this as well.
Again, Dr. Zuhaib would be in a better position to answer this. Kindly tell us about the different steps after clearing the PLAB and going to UK and starting a specialization program in surgery there, and the time it will take.
So once you complete your Plab exam, you will be applying for generally speaking, a non-training trust grade post at an FY2 stage. During this time, you will have to create a portfolio and build an evidence to apply for core surgical training or basic surgical training, which in Pakistani terms would be like the first 2 years of your PG ship in surgery. The time that it will take really depends on what evidence you have already, and how you compete against how you compete against the guys over here. It's generally a bit more competitive than other specialities, but I would say that it can take up to 1 to 2 years for you to get a surgical job. But certainly, if you have used your time well in Pakistan, then it could be 10 months. But it could take up to 2 years as well. It really depends on how you've built your portfolio and how driven you are.
Thank you. So the next question is, does the teaching only include medical relevant topics or teaching in other aspects as well? This is
No, I think
with regards to what you were
yeah.
mentioning.
I don't know what they mean by other teaching, but I think generally for medical specialties, they would expect you to do teaching on medical topics, isn't it? Yeah, I think so. Yeah, generally speaking, yeah. But it's very flexible. You can teach the nurses, you can teach anyone in your departments, and I would advise, especially people doing house job, to set up teaching programs. Within their departments, which can be overseen by your professors. And that's also actually a great way to also keep your knowledge fresh. But the answer is yes, it has to be a medical teaching, not any non-medical teaching. So, yeah.
Okay, can Dr. Mubin kindly elaborate on how we can do research in Pakistan and any other tips?
I didn't graduate from
Yeah.
Pakistan.
So
Somebody has
yeah.
posted this question. Can Dr. Mubin kindly elaborate on how can we do research in Pakistan? So they
So
want to know, want to know how to do research.
I think Dr. Zahir might be better suited to answer this. I didn't
Yeah.
graduate from Pakistan.
Yeah, I know.
Yeah. So yeah, to do a research, I agree it's generally tricky. So I think the things that you need to do is, um, Hussain, as you said that you have a research department. I think not every medical school has a research department, but the things that you can do is contact your community medicine department. They generally do some sort of a research, and they will be able to help you. Sort of do a publication. That's what I did. So I contacted another medical school and their community medicine department, and I said I want to do a research. And they said, "Do you have an idea?" And I said yes. And then sort of we started our process then. So that's one way. The second way, if you do not have a designated research department, will be to see within your teaching hospitals if there's someone who's fairly active in the research department. There will usually be only a handful of people within the hospital who have an aptitude to do a research. So you could individually contact these people. I think that's slightly hard given our culture, but I think it's certainly changing, and it's very much doable. I did have a research from Pakistan, which got me points when I was applying for training. So
Yeah.
certainly possible.
Department of Medical Education, Department of Community Medicine, some clinical specialties. Everybody is engaged in some form of research. So if students are interested, they can approach their professors and other teachers. So um, there's a question: is Plab 1 an online exam, or do you have to travel for this exam?
So Plab 1 is a written exam, but I think it's done in most parts of the world. So you don't necessarily have to travel to the UK or another country to do it. I think you can do it in Pakistan as well.
Okay.
But it's a written exam.
Evidence in which form is considered credible? This is with regards to the portfolio.
Yeah. I think any evidence. I think as you said that you guys have introduced like a portfolio. As long as it's signed by your HODs, that is that will be credible. Hassan, I can send a few forms to you as well, which you can distribute to the students, just as an example on how to record your evidence, such as the surgeries you assist in, the surgeries that you do, the procedures that you do. So you could use very similar forms, and you could actually make up, like the university can develop their own forms and hand them out to the student and do them and get them signed off by your consultants and your head of departments.
Okay,
So I can send them to you as well, but
definitely.
yeah.
You have my email address. You can send those to me, and I can distribute them to the students.
Sure.
What are the perks of working in UK?
That it's very gray and there's no sunlight, and it's
You're not
very,
selling it, Dr. Zohaib. You're not selling it.
of course. I think it's I think you get paid a lot more. You will become financially independent at an early stage, and I certainly felt that ethically I became a true doctor when I came here after seeing what I saw at my hospital. I think it certainly made me a better person. So yeah, that and the financial aspect, obviously, a much more developed country. For me, it's been a great experience. Your situation, you've already come from a nice place, but
I think it's exactly the same as well. I think it's a nice country. The working environment is very good. If you're proactive, you can do a lot with your training as well in the UK. And again, you do become financially independent as soon as you move to the UK and you get your first salary. It's a nice place to be, but you have to make the most out of it.
Okay. So what's the weightage for basic sciences subjects, for example, pathology and pharmacology in Plab 1?
I think it's a fair amount, but it's not completely dependent on it. It's not like the USMLE Part 1 where the entire exam is a basic science exam. There's a fair amount of basic science, but it's not heavily dependent.
Okay. Someone has asked, having a supply, does that matter when you are going for a lab exam?
Uh, no, I think no. I'll double check, but I don't. No, it doesn't.
It wouldn't, like,
Yeah.
your medical. So
No.
yeah, because
No, it shouldn't. No.
for the
Yeah.
Plab exam
Yeah.
itself,
Yeah.
you just need to have
Yeah.
graduated from a
Yeah.
medical school, and you
Yeah.
can give your Plab exams. As far as applying for training is concerned, it
No,
doesn't
it
matter
doesn't.
how
No.
good of a student you were
Mm,
in your medical school, as
mm,
long as, like Dr. Zuhair mentioned, as long as you have most things that score you points on the application, as long as you have those things, it doesn't matter whether
mm.
you failed an exam or not. You should be all right.
Someone has asked, what about OET exam?
What's
I think OET is an exam which is an alternative to the IELTS exam. The thing is, one way or the other, you need to prove that your English is good enough to practice in the UK. Whether you do it through the IELTS or the OET exam, it doesn't really matter. So I think whatever you can do, just go for it.
Yeah. What I would say is that people should get in the habit of presenting stuff
Yeah.
and presenting stuff in English. I've seen so many Pakistani doctors who might, they might be very clinically good, but when it comes to speaking and presenting, they're not up to par with the local standards, and that creates a lot of problems. So get in the habit of presenting stuff. I know it can be very difficult at first, but trust me, it's good to do it in front of your friends than to do it in a different country with people who you do not know.
Good advice. Does nationality play a role in the matching process?
I think it used to. I think it used to, but now it doesn't. So now anyone can apply for any training post. Previously, it was so if you were a UK or an EU national, you could apply for a few posts. But now I think you can apply for anything.
Yeah, from this year onwards, anyone can apply for round one.
So it's a great opportunity.
Yeah.
Yeah.
Okay. So can you elaborate on the path to becoming a general practitioner after doing the Plab exam?
Yeah. So once again, you would enter a non-training post. GP is actually pretty easy to get into these days. And during that non-training year, you'll have to sit a very simple test known as the MSRA, MSRA, which is a very simple MCQ-based test. And then you apply for a GP training, which and GP training is quite underfilled in the UK. As long as you are slightly flexible in where you want to work, you'll just get the job, and then you will enter a GP training program, which is for 3 years. Mind you, coming back to Pakistan with the GP training could be tricky, but that's the pathway of becoming a GP in England.
Okay. So how can I make a portfolio at an undergraduate level, and do sports and other achievements outside a medical college count in a portfolio?
Yes, it does. So I don't know, San, if you want to share these slides afterwards or not, but it's completely up to you.
The
But
video would be available to the
okay,
attendees.
fine. So if you see the portfolio checklist, any extracurricular activities do count. So yes, at an undergraduate stage, if you're third year, fourth year, or final year, there are many things that you can do, which I try to break down in my presentation. So start teaching, do an audit, try to do a publication, and try to present your work. Hassan, do you guys have these weekly clinical what are these
Clinical
called? CM?
pathological conferences?
Yeah, exactly. So present your cases there, present them, present them at conferences. I think Professor Shahid will also be, I think he'll tell you that there are many internationally accredited conferences in Pakistan. And if you speak to the right people, you will be able to present your work there. But, you basically have to break down the portfolio in sections and just start working on them. But you can certainly do all of these things from first year onwards, not even third year, but I appreciate that it can be overwhelming. So from third year onwards, you just start tick box those things, and you should be fine.
Okay. So are there a number of attempts that you can do for Plab? Is there a limit?
I'm not sure what the limit is, but even if there is a limit, from memory, I think it's 5 or 6 different attempts, which is,
Okay.
I would like, it's quite a lot.
There are two questions which are very similar. Is IELTS the best choice for English proficiency exam? And Hasib Khan has asked, one should do IELTS or OET. Which one should be doing?
We have done IELTS.
Yeah,
so
I think it doesn't really matter which one you do. I think it's about which one would get you the minimum score that you need for the Plab. I think Dr. Zuhaib as well, you've given the IELTS exam. I think it's a good exam.
Yeah.
If you prepare well for it, you should be able to get the required score. And IELTS has been there for a longer period of time. It's so I think IELTS is probably a better exam. But again, whatever gives you the decent score to.
And also there were a lot more resources online for free and also paid for IELTS. I don't know if OEM has got that many practice questions, so it doesn't matter at the end of the day. But
a related question is, how can we prepare for IELTS?
So I mean, it's got different sections. Which you can I think there are many people. Well, firstly, it really depends on how your basic English is like. If you have got fairly decent basic English, then you do not need any formal tuitions or academies. I didn't have to do any. I don't know if you had to take any
no,
practice.
I didn't do any practice courses for the IELTS. There are, I think for me, the most important thing was getting myself used to the format.
That's it. Yeah.
If you know the format of the exam and you know what you're looking for, I think that's more important. And obviously, you need to have a good baseline English.
But I did have colleagues and friends who started English, at 5th grade or that sort of a situation, and they did need some formal coaching. So you have to identify how good your English is, and then basically your plan will vary from there.
Okay. What's the minimum score bands needed for IELTS?
It's a 7.5 overall.
7.5 overall.
You need to get a minimum of 7 in each different section as well. So say, for instance, if you're getting an overall band of 7.5, but your writing or speaking is 6.5. So even though you get the overall score, but because one of the components is still less than 7, you won't pass the IELTS. I mean, you won't pass it to set the Plab exam.
Yeah.
Okay. So how competitive is getting into surgery training, and what do we need to do to make it easier?
I think
Shahid Saab smiling. Sir, do you want to take this up? So you're on mute.
Yeah, thank you. I think the system has changed now totally. During my days, the GMC worked in a different way, and it is working in a different way now. But the competition has almost remained the same. To get into good training jobs, you really have to prove yourself above average, and you have to prove yourself above average even today. We didn't have a systematic system after passing the Plab, but I think the competency-based system which is being practiced in the UK, I think the development of the portfolio is a big thing. The take-home message after all this is as Dr. Mubin Ashfaq has said, the Plab examination is basically the same as going through the syllabus of the final year MBBS. If you really go through it well, you should not have any difficulty in passing Plab. And the other thing which Dr. Zuhaib has been talking about is the portfolio. I think portfolio is basically the evidence of your competency, what you have done and what you can do. In the UCMD, with the benefit of having integrated modular system, the students can really start their portfolio for first year, because they start going to the hospitals from first year, and they have DCH and they have Pearl components going on. All that is being done from first year, and everything they do and touch and see and perform and assist, they must get that procedure seen and done, audited, not audited, um, witnessed by the senior staff nurse, witnessed by the registrar, and countersigned by the consultant. And imagine the portfolio that would accumulate if somebody started from the first year and accumulated the right way through the final year and the house job. I think they probably will have to carry a busload to carry to the UK. And if you went to the UK with a portfolio like that, I think you probably would be in a position to grab any job that you really wanted to, because PLAB is not a percentile exam, it's a pass-fail exam. So you pass the PLAB, you got a big portfolio to carry with, I think you got the world under your feet.
Dr. Zohaib, would you like to add anything to this?
No, I think he's absolutely right. I completely agree. I think you guys have the facilities there, and just people should use them and start early, as also Mubin said. I think there's not much to add, really.
Yeah.
So last couple of questions. We have already gone over time. Do electives count towards residency in the UK?
So elective will only count in the way that there are certain points for commitment to speciality, which so it's also like a minor point in the portfolio section. If you have got the resources and if you are up to date with your other things, then fine. But I wouldn't kill yourself over getting an elective. But certainly, I think if you can, and if you have done the other things, or if you're doing the other things, and if you have the opportunity, then fine. But you don't need it. It's one point on the portfolio section. But it's good to have the experience if you can afford it. Not everyone's position and situation is the same.
So last question. After passing PLAB, when will we be enrolled in FI1 or FI2? And someone has asked FI2 or SHO.
I think that depends on what time of the year you pass your PLAB exams and what time of the year you get registration. So non-training jobs are available throughout the year. It doesn't matter whenever you've got your GMC registration, you can apply for your first job in the UK as a non-trainee. They're open throughout the year. Training starts in August, on the first Wednesday of August every year. And you roughly apply for training in November, December time the year before. But that would be if you're applying for a training job.
Okay. Thank you so much. We have answered 44 questions. We still have a lot more. There were 118 questions posted today. So since there were so many questions that one went unanswered, we would like to do a part 2 of this webinar in a few weeks. So attendees should stay tuned to our Facebook page. We'll soon announce the date and time for that. We would like to thank Dr. Mubin Ashfaq and Dr. Zohaib Shahid. Thank you so much for your time. Thank you, Professor Dr. Shahid Mahmood Malik. Thank you, sir, for your words of wisdom. And I thank you all for attending this webinar. Kindly fill the evaluation form that would appear on your screen once we end this webinar. And only the attendees who fill in those evaluation forms will receive the certificate of attendance that would carry 1 CME point. Thank you so much, and Allah Hafiz. Stay blessed, stay safe. Allah Hafiz, sir. Allah Hafiz.